Let's talk about PSA. I'm Dr. Kent DeLay, a board-certified urologist practicing in West Columbia, South Carolina, and today I'm going to talk about PSA. Let's start with what is PSA. PSA stands for prostate-specific antigen. It is a protein that is made by the prostate and involved in male reproduction. We measure this protein in the blood as a way of screening for prostate cancer. Any disease process that disrupts the prostate can cause an elevated PSA. This includes infections as well as enlargement of the prostate. As we age, our prostate gets bigger. This causes many men to have a higher PSA the older they become, as the more prostate tissue we have, the more PSA we will make. One of the reasons that we screen for prostate cancer is that it is a very common cancer affecting approximately 1 in 8 men during their lifetime. Unfortunately, it does not cause any symptoms until it would become incurable. Fortunately, we do have PSA as a screening test to find it while it still is curable. One problem is there's not a certain cutoff, which is normal versus abnormal for all men. In general, the lower the PSA, the better, and the higher it is, the more concerning it becomes for prostate cancer. So when I see a man for an evaluation of an elevated PSA, I use this information along with his age, other health problems, and family history to determine his risk of prostate cancer and the need for screening. There are a number of calculators that we can use to estimate what his risk is. Historically, most men with an elevated PSA would go on to get a prostate biopsy. Now, with MRI technology doing such a good job of detecting most prostate cancers of clinical significance, I usually get an MRI before giving consideration to a prostate biopsy. This is not always true, especially if the PSA is very high and I am very concerned for prostate cancer. Men become very anxious at the thought of a prostate biopsy. It is a quick, office-based procedure which is done using local anesthesia and usually results in minimal discomfort. An ultrasound probe is placed into the rectum and we are able to visualize the prostate using the ultrasound. We numb up or anesthetize the nerves running alongside the prostate, and men usually feel very little after this. After the biopsy, we have the results within a few days to up to 2 weeks, and then can determine what steps are necessary and if any treatment may be necessary. It's important to remember that we usually repeat a PSA before we make a decision about the need for a prostate biopsy or an MRI, so we don't make decisions usually based on one blood test. I hope this content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.